Hi guys, my name is Dr. Jagdish Chaturvedi and I am going to share the real incident that occurred behind this scene from Starting Troubles.
What kind of neck dissection was it? Radical neck dissection? Modified radical neck dissection? Selective neck dissection?
This was back in 2009, first year JR in ENT in a large hospital in Bangalore, and just like any other large surgical hospital, you can be posted in one of the units. There will be multiple units. Each unit has its own schedule. They can be an OPD day on one day, the next day OT day, then a free day, and then the cycle continues. My unit was having an OT day the first day of my reporting, and it's very common that you have to do what your unit does, and I was asked to report in the operation theatre, and I went there and I was asked to assist a case that as also shown in the web series.
Hold this. Suck more. Deeper.
Now some people say क्या पहले दिन ही कौन सा ऐसा अस्पताल है जो ऐसा सर्जरी करने को देता है, but this is nothing new or ridiculous about it. Once you've completed your MBBS, you've done your surgical rotations, you're expected to do basic surgical skills, and assist the primary surgeon, things like suctioning, retraction, suturing, dressing, all of those kind of things. And a second year or third year GR is not going to do that. They're probably doing surgical steps, right? So you're expected to do this, and that's the best way to understand what is happening and be involved and learn, as teaching medical colleges like to encourage. So I was asked to assist a neck surgery, and I was basically just doing suctioning and retraction, and it was a very long surgery. Honestly, मुझे कुछ खास समझ में नहीं आया पहले दिन, and I was too scared or reluctant to even ask what is happening and all that. And after that, we were asked to go for post-op rounds. And in post-op rounds, this is a senior professor who's known to be quite an angry person, also came to the rounds to understand what happened to the case. Now I see a lot of people commenting that पेशेंट के सामने कोई डिस्कस नहीं करता है, पेशेंट के सामने ये सब नहीं होता है, पेशेंट के सामने वो सब नहीं होता है, which is true, also true in this hospital, but that's largely for the morning rounds and the evening rounds with your senior resident. When you have the morning rounds, grand rounds, we discuss across a nursing station, each one presents a case, there's a lot of teaching that happens, there's a lot of scolding also that happens, a lot of learning that happens, and instructions are given. But when you're doing post-op rounds, it's not considered to be a very long and elaborate round, because here you've already discussed this patient probably for 2-3 days in morning rounds. You also know what happened in the the surgery and all of that. In the post-op rounds, the team usually walks to the post-op room, and main focus is to see, is the saturation all right? Is there any post-op bleeding? Is there any swelling around this? Is the drain fine? What are the urine input output charting? Some basic instructions to follow up and monitor the patient. And the whole team goes, and as you can see in this case, the professor is actually being very friendly. Is inviting the JRs. Welcome to the department.
Welcome to the department.
Thank you, ma'am.
Thank you. Right? The professor does not have a premeditated thing that I'm going to scold in front of the patient. The professor just wanted to know what happened and thought that let's just ask the JR and involve them in some sort of a discussion. I think that's absolutely fair. But when the professor asked me,
Who among you assisted on this case?
Ma'am, me.
Tell me what was done.
I did not know the granularity at which I'm supposed to respond, right? What is the rule of thumb? If I was, maybe my first day was in the OPD day or a free day, maybe some of my other seniors or colleagues would have told me, this is how you need to answer. But still my fault. I assumed that I am supposed to give a very generic, simple answer, as if the professor is not knowing what was done and I'm just giving a very quick and brief response. They made an incision.
Ma'am, an incision was made on the neck, and we dissected the planes, and we removed about 7 lymph nodes from the right side, and we sent it for biopsy.
And even after this, if you notice, the professor is not really getting very angry, just questions. Is this the way you really answer a question?
Is this how you describe a case you assisted? Huh?
And I think the idea here is that, you need to be able to share details and speak very specifically, so that, there can be a decision made on the patient's treatment. But I gave a very generic response. And the worst thing that I did was I defended it by saying that it was my first day. So, I should be...
I'm sorry, ma'am, it's my first day to...
I mean, the tone was that it's my first day, and it was an excuse to not be able to answer. And that's where the professor flipped.
First day. So it's okay for you not to know anything about the patient you're assisting?
And guys, anybody can get angry at any point of time. All these ethics and etiquette are forgotten when you're angry, even for you. If you had a road traffic quarrel with someone, and we've seen so many people standing in the middle of the traffic junction and fighting and shouting, not even being aware that there is traffic stuck behind, maybe an ambulance, or maybe so many people are getting delayed. When you're angry, right? And here there was a fundamental error created on my part, is where I kind of made the note that because it was my first day, I should be permitted to be very lax about this whole thing. And a senior professor or teacher does not want to set that tone right from the beginning, right? Because getting an opportunity to operate on a patient, somebody's body, you're doing a surgical step, and then you're so carelessly responding and then justifying it, can flip anybody out. I would probably get upset if someone were to say something like this to me while I'm doing my rounds as well. And I totally understand that. And if you can see here that the professor is basically also telling the answer and telling and demonstrating how it should be done in front of the patient.
What kind of neck dissection was it? Radical neck dissection? Modified radical neck dissection? Selective neck dissection? And
I realized that, okay, I should have said this. And in fact, which you can see in the scene, he's not, the professor, basically played by Renuka Shahane, she's not very over the top angry. She's just telling, what are the stages, what are the levels of the lymph nodes, or what kind of neck dissection was done. These are the things that, you should be saying.
What was the staging of the case? TNM classification? You don't know that also?
And I realized, that, okay, I should have given a more detailed response. And that is what, happened in the first day. Now, this patient smiling and seeing is obviously a bit of a dramatization. And the professor is entitled to think that, I was just trying to get away with something. So don't play games with me is actually something that my professor used to use a lot.
मजाक समझ के रखा है सबने? Don't play games with me. जिंदगी नरक बना दूंगी मैं.
So this is a kind of a reference made directly to him. And Zindagi Narak Bana Dungi is thoda sa dramatization. Also, I've heard this in other hospitals during my internship and other places. But, that is quite possible to see. And this is what really happened, guys. But what it did is it made me a lot more serious about, every time I do a surgery, I'm completely prepared, completely aware of what is happening. And when somebody used to ask me after that also what was done, I would try my best to actually answer the exact details. And I think it really was a good learning experience. Even though this scene is actually toned down a bit. This is inspired by another time where a senior doctor asked me, what was done for a parotid surgery, and I remember saying that, we made an incision, took the parotid out, and closed the incision, and I was kicked out of rounds. Kicked out of rounds. I've had files thrown at me. So for all of you people who are saying that ऐसा कैसे बोल सकते हैं, ये ज़्यादा कुछ था भी नहीं, to be very honest. But guys, if you liked this narration of the real incident, please let me know if there are any other scenes from Starting Troubles that you would like me to share the actual incident about, and it'll be fun to do that because every scene from the web series is inspired from real events. हर सीन में सच्चाई है और हर सीन में असलियत है. और अगर आपको लगता है कि ये बहुत unrealistic है, realistic है, it's just a matter of whether it happens a lot or happens rarely. But with that, thanks for watching Starting Troubles. If you haven't seen it yet, on YouTube channel of Buddy Bits, do go and watch Starting Troubles and leave your requests of which scene you want me to talk about in terms of what was a real incident in the comment section below. Take care, stay safe.